Thank you, Deputy, and I totally agree. Of course they would.
Thank you very much, Minister, and I fully concur with you that we don't see the full utilisation of Mallow Hospital, and I'm glad that you actually brought these figures to the House this morning so we can actually discuss them in public forum. I have been advocating for the further and better use of Mallow Hospital for many, many years now, in my role as a councillor and my role as a TD for the last 12 months, and I concur with you. There's a lot of work to be done in relation to utilising Mallow Hospital beds, and we need to work together to make sure that that is the case. We can't have a system where we have overcrowding, people waiting inpatient beds in Cork University Hospital and the Mercy University Hospital, where there's actually vacant beds in Mallow. This hospital, Mallow Hospital, serves a huge amount of area, covering the border of Limerick, Kerry and Waterford, and it covers the metropolitan area of Cork City, and every patient I talk to that's waiting on a bed will go to Mallow absolutely for the care. So we need to work together to make sure that that is utilised as best as possible going forward. Thank you, Minister.
Thank you, Deputy, and I totally agree. Of course they would, and of course they want access. And then 2 weeks later, Saturday, December 27, there were 15 beds in Mallow. Now, that's not Mallow's fault. Do you know what I mean? The beds are there. What's important for the region is that they move people out of other pressurised hospitals to make sure that they're getting really good care in Mallow. But there was 15 beds in Mallow vacant on Saturday, the 27th of December. There were 10 beds vacant on Sunday, the 28th. And the following week, Mercy Hospital, just down the road, was under pressure with 11 people on trolleys on the Monday morning and 13 people on trolleys, 11 people on trolleys on the Sunday morning, the 28th, and 13 people on the trolleys. So Mallow has 10 vacancies on Sunday the 28th, and on the same day there are 11 people on trolleys in Mercy. Now, I cannot stand over it, and I have an obligation to point this out bed by bed by bed, because this is the type of usage that we're talking about. This is the sort of patient flow out of Cork, out of Mercy. Cork is an enormous hospital. There are patients that can be safely discharged to another excellent, excellent medical care facility. But unless you and I acknowledge, you and I will go down like Egypts, opening more beds and being delighted by it. And then 6 weeks later, there's beds left empty and there's people in danger in emergency departments. It's not okay, and that's why we have to just investigate it and call it out where we see it. And since January the 8th, there has been no bed vacant in Mallow, and they are now using surge capacity consistently. So we have seen an improvement, and I do want to acknowledge that in the region, but that has to be consistent now.